do a radial nerve glide now. This is a little tricky to get your head around, so I'm going to explain each of the points and then hopefully we can bring it all together. It's one of the trickier ones to do. There are other ways to do a radial nerve glide. This one I find personally is the most effective for me. You probably will find if you try out different versions, different ways of doing it, you might find your favorite. There are certain positions we need to put the body in to be able to tension the radial nerve and then slack it off. So I've said in other videos about the reasons why you would bring in tension and then slack off. That's for our range of motion. And if there's pain, if we're dealing with pain or pins and needles, we might want to slide and glide. So I will teach you how to do both. So for the radial nerve, that's the nerve that innervates the top of the hand. We're going to start with thumb adduction or abduction. Excuse me, adduction. Get those two mixed up. You can also call this thumb flexion or horizontal flexion. It has lots of different names. So you're going to bring your thumb across. Okay, then we'll do wrist flexion. And then we're going to do ulnar deviation. Now, ulnar deviation is where your little finger comes closer to your ulnar bone or your forearm. So sometimes we call this the Queen's wave. So you're just going to think, I want to bring my little finger closer to my forearm. And I'm just going to show you from this angle, just in case it's easier to understand. So this is my wrist in neutral, and then I've got ulnar deviation, little finger drawing towards forearm. Okay, so we put all of those together. Thumb adduction or thumb horizontal flexion, wrist flexion, and then ulnar deviation. Okay, we're going to do that with the arms straight. So I'll talk you through what the arm is doing. We want to have the shoulder down, as always, to create that space in the brachial plexus. Then we want medial rotation. So if we stood in anatomical neutral, medial rotation is where we rotate the upper arm inward. Your shoulder will feel like it rolls in. Your palm will face behind you. Okay, so neutral, medial rotation, shoulder down. Then tuck your thumb, flex your wrist, and ulnar deviate. From the side, just so you can see, we're not going back with this one, that would be a different nerve. So we're keeping it sideways to the body and we're hugging the arm in. So squeeze your armpit as if you're trying to plug your arm in towards your body. So retracting your scapula a little. Okay, so it kind of looks like I'm trying to get someone to give me a cupcake or something in the back of my hand, like, here, give me a secret cake. So that will try and help you remember. Now that we've got all of this happening, we are currently stretching the distal portion of the radial nerve. So we can take the chin down and gently roll the head away, and now we're stretching the proximal part, so the part of the nerve that's closest to the body. So this awkward position is the nerve in maximum stretch, and we can move the head. So keeping the hand, keeping the arm, everything exactly as it was, remembering to have that ulnar deviation, and then just moving the head. This might feel like a really intense neck stretch to you. Or we can bring some portion of this in and out. So this is where it gets tricky. It's difficult to floss the distal end of the nerve because this position in itself is really awkward. So you have to feel comfortable with this position before you make changes to it. The easiest thing to do is to take the wrist in and out of flexion. All right, so let's do the head first. Chin down, ear to shoulder on the other side, shoulder down, medial rotation, hug the arm in, tuck the thumb, flex the wrist, ulnar deviation, and then gently, because this can be intense on the thumb, flex and extend, or flex and bring the wrist into neutral. So now you're just moving the distal end of the radial nerve. And then relax. Wow. You can, if you've got enough room left in your Swede, you could slide and glide this. So what that would look like is bringing everything into its position. So this is slacked. So I'm going to release the wrist on this end. So I'm stretching the proximal end, and then I might bring the head out, but bring in ulnar deviation and flexion of the wrist. So now I'm stretching out the distal end. And you would move through the two. And this is taking the radial nerve into a slider and glider. Again, it's very this guy. Let's try the other side. So we'll start with the thumb adduction, wrist flexion, ulnar deviation, which is really tricky to do. You can do ulnar deviation first, but when you start adding all of this, it feels really tricky. Don't be surprised if you get those feelings, those sensations just from the start, just from this. So you might find, I don't want to add the head, I just want to do the wrist, but do remember the ulnar deviation, that's really important. So you could keep the wrist and just ulnar deviate, which is a lot trickier to do. Okay, shoulder down, hug the arm in, chin down, roll that head away. Now the nerve is in a big stretch, and then we release. Big stretch, and then we release. So this is your tension and slacking. Again, probably wouldn't use this if we're in a lot of pain in this area. So instead, the head can be in a stretch while the wrist is released, and then the head releases as we bring the wrist into flexion. So now we are sliding and gliding. Try and make sure that shoulder stays down. And release. Don't be surprised if you get pins and needles in the hands and funny sensations. We are taking your nerves for a little bit of a walk around your body. So it can feel very strange. You can feel like, ooh, I've got a strange sensation in my hands and in my thumb. This is why we say don't do it too often. 10 to 15 movements or slides a day is enough for your nerves. All right.